Students at some schools in Washington state can't buy soda or candy anymore, but girls as young as 11 can now get contraception without their parents' consent. Is that a good idea, or is it wrong to bypass parents altogether? Penny Nance is the CEO of Concerned Women for America and a mother of two, and she's against the policy. And Nell Gibbon Daly is a psychotherapist and mother of two, and she supports the policy. We have a debate, so I'm going to get out of the way of this one. Nell, let me start with you.
Sure.
Why do you support this policy?
Well, first of all, it's a state law and it's a public health concern. So the American Academy of Pediatrics has come out and said if we teach children and give them access to birth control in schools, they're more likely to have safer sex and also delay sexual activity.
So, Penny, this is Washington state law, but 11 years old?
You know, we just celebrated the nation's birthday yesterday, and I think our founding fathers would be turning over in their graves if they realized how much statism has taken root in this nation. And this is a perfect example. These bureaucrats in Washington state think they know better than parents. Parents aren't being informed. They're not giving any choice in the matter. They're getting between the parents and the children. And so once this 11-year-old walks into a clinic, gets an IUD, and then goes home with a health complication, the parent has no way of knowing. And we talked about the law. The law in Washington state says the age of consent is 16. So why is an 11-year-old asking for birth control? More than likely she's being abused.
Penny,
this is not helpful.
Penny brings up some great points here. There are medical concerns with IUDs, inflammation problems that parents might not be aware of. And if parents don't have a say in this could be a problem, especially medically for these young girls.
Well, I think that the language that is being used is that you're saying that parents don't have a say in it. Parents absolutely do. If parents have an open relationship with their children, but if they have an open relationship with their children that they've established already, then the child can go to the parent and tell the parent they're thinking of becoming sexually active, and the parent can educate them at home. The point of having the clinics actually in school is that when that relationship isn't happening in the home, the child has a place to go in order to protect herself sexually.
Okay. Penny, let me give you, I want to give the statement from the school in here and from the state Medicaid program so you can respond to this. This is what they say. If the young person is not choosing abstinence, she should be able to select a long-acting reversible contraceptive and have it inserted without parental consent.
So are they handing out lollipops and teddy bears with this service? You've got middle school kids walking in the clinic, getting this treatment without the parents knowing. You know, why can't we be on the side of the mom who is in over her head? Maybe, like, think about the inner city mom in Baltimore who's slapped her kid upside the head for throwing rocks at cops. I want to be on her team. This is paternalistic and big government getting in between the mom who loves her child and hasn't been given the opportunity to weigh in. They should be bringing the mother and the father, if there is a father, into this process and let them weigh in. Something is very wrong when a child is asking for birth control. The next question out of their mouth needs to be why.
Right.
Your response to
that. So in this country, the average age of girls having sex is 15 years of age. By the time that they're 15 years of age, 13% of Americans are having sex. By the time that they're 19, about 70 to 90% of children are having sex. So again, I'm a mother. I'm on the side of moms. I absolutely want to be involved in my child's sexual well-being and health. But again, if that relationship isn't established at home and the child doesn't feel comfortable, a girl doesn't feel comfortable going to her parent, she should be able to have access to birth control. She should be able to have access to good reproductive health information.
Penny, what about that point? You might find it outrageous, but does Nell bring up a good point? What if there is not a safe environment at home to be able to talk about this, and if this child is going to go out there and have sex, where could she go?
Okay, first off, the average age of beginning sexual activity is not 15. It's much later usually. When you've got this small proportion of the population that is engaging, you've got to bring parents in. You've got to allow people who love these kids, caretakers, to weigh in. Now look, there are bad homes and there's certainly bad parents, but these are overreaching bureaucrats overwhelmingly getting between the parent and the child. Certainly there are plenty of community health centers, there's doctors that can get involved in this situation. It's not the school's place.
Now I'll give you the final word.
Yeah, all I would say is that there is 4 million unwanted pregnancies in this country, and a large part every year, and a large part of those are teenage girls, and those teenage girls would not have to go through finding more invasive procedures to perhaps abort an unwanted pregnancy if they had access to reproductive contraceptive methods in schools.
An unbelievable debate this morning. We want to hear from our viewers this morning. You can weigh in on our Facebook page. Penny and Nell, thanks for coming in and debating this tough topic. We appreciate it.